Good morning. My name is Rosie Tvarak. I'm going to be the one facilitating this session. Such an honor. Thank you, St. Paul, for believing in me. So first, my name is Rosie Tvarak. I'm a public health professional, also gender professional, a feminist researcher, and a SRHR and gender advocate. So our program today will be a short presentation followed by a Q&A session. I'll be the one facilitating the Q&A session. So please welcome to the stage Dr. Salama Shatu, medical doctor and community nutrition specialist and certified nutrition health and life coach. She's here today representing the Ethiopian Medical Women Association and as the PI of Through Her Eyes. So thank you so much and welcome to the Our second panelist is going to be Tasfay, another young and very, very vibrant innovator. She's a principal consultant for KP Innovation Solutions and the CEO and founder of YNL Digital Health Platform. So please welcome her to the stage. That's you. Our third panel is going to be Dr. Betel Samson, a medical doctor from Addis Ababa University, who is the founder of a TK breast cancer screening app and Saba menstrual hygiene app. So again, please welcome her to the stage. The fourth one is going to be Dr. Loza. I'm so happy to see her. She's my junior in Nativity Girls School, right? Yes. So happy to see her again. Okay, so it's going to be Dr. Loza, medical intern at St. Paul Hospital and project manager at Tanka Podcast. So please give her a really big welcome. So this is going to be a very interesting panel, really phenomenal women doing really amazing things regarding SRHR innovation, research, and so many things. So they're going to have a presentation. We're going to start from Dr. Salamite, then that should be followed with Dr. Bethel. Then yeah, we'll introduce. So thank you very much. I hope you'll jot down your questions, your thoughts, and also your so many things, and we'll forward it to it in the Q&A session. I'll leave that. Thank you.
Good morning, everyone. It's a pleasure to be here. My name is Dr. Salam. I am currently acting president of the Medical Women Association. I'm also a proud alumna of St. Paul, so it's a pleasure to be here and to be back as well. So we give this presentation, the title of the presentation is Engaging Women Physicians as Researchers, the Bridge Evidence Gap on Global Challenge. I will give you an overview of the project that Mwa did from 2021 to 2022. The project title is Through Her Eyes. We had a research title called Impact of COVID-19 in reproductive health care in Ethiopia. The objective was to have a national overview on the trends and access to SRHR during the COVID-19 pandemic. We have different outcomes and deliverables from the project, including a documentary interview findings, because we thought it would be better to have a documentary, to have a storytelling to make sure that our audiences get what we tried to say and to resonate with the stories that come out of the project. We, of course, have a research finding, and finally, we conclude the project through a policy brief named SRHR as an essential component of COVID-19 mitigation response. So we have the publication. You can see the details once we have a tea break. I just want to focus on the significance of the project. This was our first project as a research project that we undertaken in Mwa. So we tried to engage female physicians in the process of evidence generating during the global pandemic. You know, COVID-19 has affected tremendously the different social, economic, and political scenario in each and every nation, and we try to see what that would look like when we put reproductive health at the center. So it's not that common for female physicians to fully engage in a research job. We know that only 8% of researchers in Ethiopia are women, and that that that's not a number that talks exclusively for health research. So when it comes to health research, we have a very small number of female researchers. So we try to engage all female physician research team, and we also try to engage MWA members who are outside of Addis Ababa to be part of the research, because we selected for different tertiary hospitals to assess the trend of reproductive health, how they're affected, impacted by the pandemic. So we were lucky enough to give a chance for female physicians outside of Addis Ababa to be part of the team. So through the process, even though it was our first research project, it became this platform that also empowered us in terms of being, a very good researcher. So we also saw it as a capacity building moment. And this project was funded by Open Society Foundation. So we had an opportunity to collaborate with partner organizations who had the same interest as we do. So one of the things that we learned from these researchers, it's always important to have the view of women, the view of female physicians when it comes to different health issues. We don't necessarily put female physicians at the spot, but we also try to make sure female women in general. We have patients visiting St. Paul's that were interviewed to tell us their story, how the pandemic affected their life, because it was not the same for a man and the women, how they got impacted by the pandemic. And we wanted to hear their story in their words, and we make sure that we capture that essence of a story that could be easily accessible. And it was in a way that resonates with everyone, because these women talked about how it was difficult for them to get the service that they needed during the pandemic because so many things were restricted. They talked about how the labor process was unique in its own way, because there was a pandemic and healthcare professionals were basically mobilized to another area. So this was the moment that we actually get how it's important for women to get engaged in topics and issues that really matters to them, and they have to be the one who has to tell the story. It's not always good to expect another one to be an agent for their cause. So this was the moment that women physicians took the lead to make sure that we spoke the truth, we spoke the story of our own health issues, and then women in general were given the platform to talk about how the pandemic impacted their lives. So as I mentioned, this project ended by publishing a policy brief. At the end of the day, we went to gap the research, the data to the implementation. So we thought publishing a policy brief would do that. So we make sure to publish a policy brief that has its own specific recommendation to make sure not only the pandemic, but we're going to have different global challenges coming. So it's always good to have a recommendation that are based on evidence, and ensuring that women physicians are involved in this evidence generating is a crucial thing. So that's what we did. And as I mentioned, we have the publication at hand, and you're very welcome to read it. And yeah, thank you.
Good morning, everyone. I'm sorry to our moderator for stealing this spotlight. Um, so my name is Dr. Vital Samso. I am a medical graduate, recent medical graduate in October, and the founder and the CEO of a health tech startup that usually focuses on women's health. And initially, we had an application called Tegi. Tegi was made to raise awareness about breast cancer. And after that, we were able to get funding to do SRHR health platform, and we chose Sava. So Sava is a digital platform that mainly focuses on SRHR health. So the reason why we chose to do this application and this website and also this Telegram bot all included in our digital platform is because we have noticed that I type. So we have noticed that 41% of the Ethiopian population is under the age of 15, and the majority of the African population is it's in the young age group. And when we looked at the project, when we looked at the health issues that were mainly affecting this age group was related to sexual and reproductive health. So, and when we wanted to focus this project, we looked at three main things that were really affecting the SRHR group. So the one thing was the menstrual health and hygiene. So when we looked at the menstrual health and hygiene aspect, there were a lot of young girls and women that weren't going to school because of the lack of appropriate health, the appropriate hygiene material. Also, the lack of awareness when it comes to menstrual health and hygiene, and the lack of a platform that everyone would have an honest and an honest and open conversation was not it was lacking. So we wanted to create a platform that women felt comfortable, young women and girls felt comfortable to have that discussion and also to access the services of sexual and reproductive health rights. So and the other one was unplanned pregnancy and unwanted pregnancy among the teenage group, and also STIs. So when we looked at sexually transmitted infection, around 1 million youth worldwide actually contract STIs every day. And we wanted to raise awareness about that issue. So we came up with a solution called Sava. So Sava is a digital platform that's made for the Ethiopian youth group of Ethiopia. And it is a platform that is for providing education and to have open discussion on SRHR issues. So we have a website, we have an application, and we have a Telegram channel. So the website is a peer tracker that also incorporates the Ethiopian calendar. And also it reminds women to take their oral contraceptive pills every day. Also, we have an educational platform that is accessible in 4 languages, including Amharic, English, and Tigrinya and Oromo. And the other ones is that the things that we want to teach are about menstrual health and hygiene, family planning, and sexually transmitted. And through our website, this is what the app looks like in a nutshell. And we have a website that allows our users to have access to the subjects that I mentioned. Also, we have a Telegram bot that's called Ask Sava. So through Ask Sava, anyone is allowed to ask questions to licensed and qualified physicians. In this way, we hope to also tackle the issue of unemployment when it comes to fresh graduates of medicine. Yeah, so the plan that we want to have is to have no more absent days from school because of menstruation, and also to destigmatize menstrual health and hygiene as a whole, as well as family planning options and STIs, including HIV and AIDS. Even though the rise is exponential when it comes to STIs, we don't really have an open platform to have a discussion. We wanted to have that solved. So this is the team, and I am looking forward to your questions. Currently, we have been able to upload our application on Google Play, and we are working on uploading it also on Apple Store. And our website's up and running. Also, we are trying to recruit more doctors and physicians to be part of our Ask Saba Telegram bot, so that they will also have an idea of volunteering, as well as we also want to have them employed in some way. So I'm looking forward to your questions and answers. I think by the next one is.
Thank you so much. Our next presenter is going to be Dr. Betel. So yeah, and followed by.
Good morning. My name is Loza, and I am the founder and project manager of Tankwa and a podcast host at Tankwa as well. It is an honor to be here. Thank you. Start with meeting Tankwa. Tankwa is a SRHR conversation platform. How it started is Tankwa is a baby. So um, most of us volunteers at Tankwa were volunteers who would go to high schools to teach about SRHR issues, and we loved meeting the adults. And then COVID came, so we no longer could do that, but we really wanted to do something about the SRHR issues that were arising. So Tankwa came. It's a conversation platform. It started with an idea of breaking the fourth wall in a room. That that when we are in a room, there's a fourth wall which basically confines the conversation in one room. And through Tankwa, the conversation platform that we have, we kind of have it out there, the conversations on a sidetrack. So it's a podcast recorded bi-weekly by medical students and aired on Telegram, YouTube, Terraki. For people who don't know, Terraki is a podcast app by Ethiopians. And recently, we also have sessions on Clubhouse. So you might be asking why we chose a podcast. So we chose a podcast because there was a podcast boom with COVID-19. People started to resonate a lot with podcasts instead of TV programs or newspapers or radio shows. A podcast became the companion that you have while you're walking, while you're jogging, while you're like at home sitting. What we basically did during the COVID-19 pandemic. Uh, so we chose podcasts as a way to reach people. And I love the question why. That's why there will be lots of whys. So why Tankwa? Uh, why Tankwa? Because Tankwa basically like mainly translates as a kayak in English. It is a main way of transportation through the lake throughout Ethiopia. And fishermen and priests and people who go who would like to cross the lake use it. That's basically what people use to cross the lake. It's a safe space to do what you want to do on the lake and arrive safely to where you're going. So we hope Tankwa will be that platform where adolescents come, get what they want and learn, and then get to adulthood. So yeah, that's why we named it Tankwa. So what we do through podcasting is we provide information, like we provide when we say we provide information, it's that information we learned throughout our works that information is a very important thing, that it should be updated, it should be in a language that we understand, it should be it should be accessible to everyone. So we do that, which we are very proud of. We create youth leaders. I see our teammates here. We're all young people. So yeah, there's that as well. We also contribute in digital health, which seems to be contributing a lot to health in general these days. So we're also proud of what we're contributing in digital health as well. So we have just a random list of some episodes that me and my teammates like. The first one is Helen Will You Have Tea? Helen is over there. So it's an Amharic, Helen Shait Alish. My personal favorite podcast episode where we talked about consent while asking Helen to, and it was a very interesting topic. We also had an episode on cyberbullying, addiction to pornography, my personal favorite as well, because no one seems to talk about that as much as we should. We also have the contraceptive series where we discuss all contraceptives and why we should or when we should not use them. We also had 5 reasons not to use condoms, not to use it, why people don't use condoms. We also had an episode on tampon menstrual caps, and our recent favorites were our Clubhouse station. 2 panelists here were our Clubhouse station guests. So that's also interesting. We also have many more episodes, and you should check it out for yourself. So recently, we had the honor of being one of the attendees by Rise Up. So that was also one thing that happened in Tankwa. We had our challenge. The challenge would be the digital world, as fascinating as it is. It was very difficult to navigate and keeps on changing. Then there are lots of competitions. There are lots of things to learn. And as medical students that we are, of course, there are lots of things we have to learn besides the things we learn at school. So there was that. And we're also constantly worried about the digital gap. So we reach people in Addis, we reach people in bigger cities.
who are reaching, how can we reach the people in like rural areas? How can we reach people who don't have phones, who don't know what podcasts are? That also have been a question. So we're planning things. So we are planning to have like on ground town clubs at universities, which we're very excited to start. We're also starting video episodes, and we're also hoping to be more competitive in the digital world. So yeah, that's, I look forward to the questions you raised, and thank you, and please listen to them.
Good morning, everyone. Hope you can hear me. Thank you all for being here today, and thank you for having us as well. Excuse me for my voice, that's a little cracking. I'm getting over a cold, but I'm here today to talk to you about Yeni Health. Before we get started, how many of you guys have heard of Yeni Health before? With a raise of hands, raise them high. Okay, nice, great. So I'll be using my 10 minutes very concisely and optimizing it to tell you about Yeni Health, what we are, and what Femtech is. So Femtech is an umbrella term used globally now. It's a growing industry, which describes a suite. It's an umbrella term that describes a suite of different digital services, softwares, or hardwares that's used to provide women's healthcare. So we fall under that category. And at Yeni Health, we're leveraging technology to support women gain self-agency and make informed decisions to achieve their sexual and reproductive health goals. That's kind of the key thing that I'll be discussing today. Hello? Okay. So we, like I said, we are the first femtech startup in Ethiopia. We're super excited to pioneer this industry here. Our mission is quite simple. There's three things that we're trying to accomplish: is improve reproductive health through education, access to products and services, and digital tools that will help women make informed decisions. So before I get to what our platform is, what our solution is, let's talk about the problem. So there's three key problems that Yeni Health is trying to solve. So the first, that I think many of you guys in this room know and understand, is the unmet needs, right? The unmet need for access to contraception and family planning. Across Africa, I mean, sub-Saharan Africa globally bears the highest proportion of women with an unmet need. Across sub-Saharan Africa, 25% of women have an unmet need. In Ethiopia, only 24.4% women have an unmet need. So this is a massive underserved market that needs critical attention, and we're trying to tackle that. The second problem is the experience that comes with accessing products. Many of you guys already mentioned that as well. As a woman, going to ask, talk about, and receive care around SRH is quite difficult because of our societal stigma. There's provider-induced stigma as well that we can't hide. So with all of these things, the experience is filled with stigma, which is a problem. And the last problem, and the most important, I think, is the access piece. So the limited choice and unreliable stock of products across the country. So when it comes to women's health products, especially SRH products, it's always quite hard to find different choices. So you go to a pharmacy or a hospital, you're given a couple choices, you kind of take that. But we're trying to make it more available and reliable as well. So how can we solve that problem? Which was where we started. Although we are starting in Ethiopia, this is our home, this is our first base, we're really trying to build a trusted brand for millions of women across Africa. Why? This is because this problem is not unique to Ethiopia, but it's a problem that many African women face across the continent. The population size that we're targeting in Ethiopia is 27 million women. Across sub-Saharan Africa is 280 million women of reproductive age. And also this number is expected to reach 500 million by 2050. So you're seeing a massive growth in demand, massive growth in problems keep increasing. So we're trying to create something that will be sustainable and solve these issues. So what Yeni Health has done is we've designed a digital one-stop innovative solution. There's three main components to our platform. And we also have a booth, so you can kind of go out there and check it out during coffee break. But the first and most important one is, overall, we're trying to introduce the first culturally responsive digital platform for African women. Many times, including myself, we use platforms that are made by Western societies for Western women. So we're really trying to embrace the cultures that we have, the religion, the societal thoughts around these things, and we've used that in our development cycle. So first is our AI-powered menstrual pregnancy and medicine tracker. So this allows women to track their menstruation, allows them to track and monitor their pregnancy, but also allows them to track their contraception use, setting reminders, and so on. The second important feature is the women-centered e-pharmacy that we have on our platform. We believe that information without access doesn't get the job done. So this piece of it is once a woman is able to learn about what she needs for her body or for her health, she can also access those products directly on the platform. So the e-pharmacy focuses just on women's health, SRH, family planning products. And last and most importantly is our learning portal and our telemed feature. So that feature is slowly growing out, but this allows women again to create that forum to communicate, but also reach and connect with professionals so that they can reach and access services beyond our platform. So we've segmented our audience so we can reach and target them appropriately. So the 3 segments that we have are high school and university students. These are adolescents, these are youth. The second group is marginalized women, which are the underserved, as you know. These are women in semi-urban areas with lower economic level, lower digital literacy, and we're working with the Ministry of Health and extension workers using their distribution channels to access them. And lastly, women in urban areas with higher digital literacy, easy to reach, and higher spending power as well. So let me talk about how it works quickly, just so you guys can understand how the platform really works. It's quite straightforward. So women at the comfort and privacy of her home can access our platform either on her Android phone, her Apple phone, or our web platform. She can go on there and get the suite of services that we have. So we have the learning, monitoring, tracking. We have the shopping and ordering. We have the pickup and discrete delivery options available. Then we have the support line linkages, and we have our doctors that are online that answer questions, give guidance, and support as well. So just to kind of give you an example of what kind of products I mentioned earlier, but these are about, I think, 8 or 10 categories that we have currently. Again, they're specific to women and SRH for right now. We plan to expand and have more prescription drugs and then also cover the entire end-to-end women's health products. We also have unique learning kits. We see that a lot of the issues come because our educational system doesn't teach SRH when they're in high school and so on. So we've developed kits that are learning aids that schools can use to teach and talk about difficult conversations, whether it's simple things about menstrual cycles or sexual health or pregnancy or so on. These are tools that can be used to educate and inform women. This is what the experience looks like on our web app. The e-pharmacy, you can see, it's available right now in English and Amharic. It's straightforward and clean and simple to use. We are it took us over 6 months to develop this platform. So a lot of time, effort, and thinking went through how it should be designed and so on. So you can see that it's very clean and simple to use. Somebody can directly just pick a category, order a product, get their delivery or pickup set up simply. And then this is the learning portal experience. We have a library of resources. So we have our educational videos that are developed by our doctors, that are short bite-sized videos that talk about these topics that are hard to understand. We have blogs that are also written in different languages, and then we have our freebies resources that women can download, which are PDFs that help women understand their cycle, create a nutritional recipe for their health, and so on. So these are all available on the platform. And lastly, the mobile app right now is being tested for, I don't know what number of times you've been testing it, but we're launching our new features with the tracking and so on. So this is how the platform kind of looks, as you can see. There's lots of screenshots here, so it may be difficult, but again, we have the demo out there so you can see it. But it has all of the features on the web app, and it's also simple to use, direct, very easy for your eyes, and user-friendly. So ultimately, Yene Health's goal is to empower women to self-educate, self-decide, and gain self-agency. So this term self is really, really important to us. I mean, hence our name, right? Yene Health. It's your health, your choice. So we really emphasize on making sure that the power is in the hands of the woman. If she wants to learn something, it's up to her how to learn it. If she wants access to it, she can have the power, authority to go and access that product. So all of our services really always come back to that. How do we make sure that the woman is always in control? So beyond the platform itself, control is a big thing that we're adding: convenience, the judgment and stigma-free access to services, confidentiality, and choice. These are really important to us. But also our data and technology play a key role, and there are enablers for our service. So having our AI-powered engines really allows us to give women a personalized experience. So if a woman is saying her reproductive goal is to conceive within the next 2 months, we give her content that is related to conceiving, when she should be engaging in sexual intercourse, so she can plan a safe pregnancy. She doesn't want to conceive, what she should be taking, what are the methods, the options here. So it's really based on personalized experience. And our ultimate goal and the role we want to play, I mean, we are a social enterprise, so we are not an NGO, but we see our role as very critical in the ecosystem. We want to be the connector, the platform that is allowed and able to connect the different pieces when it comes to women's SRH. So whether it's policy, women's rights, the labs, the clinics, and so on, we want to be able to use our platform to be able to connect women to all of these services in one place. So that's how we envision ourselves in that role. We started this journey actually a year ago. I love the COVID baby thing. That's the same thing with us. So it was 2021 when we started the inception of designing this startup. We've raised funds, did many pilots, understanding the niche area, why we want to focus in that space, done research, but also have built lots of traction with women. So we've done lots of focus group discussions. We've done surveys to understand women. We really believe that women should be the center of all of this. So we always make sure that we're using the human-centered design when we're building something.
How was it? How was the presentation? So give them a round of applause. Thank you so much for your time, for your clarity, and also for the presentation. Now we're going with the Q&A session. So first, I'll like to give you a chance, one or two questions per person, and we can take 5 questions, then we can move forward. So please, any question regarding their work as well as also the the innovation ecosystem, because we're going to talk about innovation and the role it plays in the SRHR sector. So please, for a question. You have another mic?
Thank you. Am I audible? It's so nice to feel like women come together and do this the SRHR problem. My name is Sarah. I'm an MSc student at the London School of Hygiene and Tropical Medicine. So my question is for those who have developed the apps for the SRHR problems for women, most of them were answered by this, but then again, the others may have something to add. So my question is, how is this things going to address women in the rural settings? Because we have women with low socioeconomic status and women who have no access to modern education. So how are they going to be familiar with these apps and make use of them? Another question that I have is, how about women with disabilities? Those are one of the key population groups that we want to help. So how are these projects planning to address women in key populations? And a general question for all of the presenters, as women, what are some of the challenges that you faced? We all know the gender inequality and the effects of those when you're trying to come up with solutions. So what are some of the challenges that you guys faced and how did you tackle this? Thank you so much.
Thank you so much. Questions? It can be comments, questions.
Okay, thank you very much. I'm Mikias, an intern at St. Paul, and also a member of TANQUA. And they all have great ideas, but a couple of questions I have is, one, what is the role of men in this ecosystem, and how do you plan to address the knowledge gap that there is among men in SRHR for women? And significant part of this presentation was talking about judgment and stigma, and how do you plan to address those the source of that judgment and stigma? Thank you very much.
Thank you so much, Mikias. Please.
Thank you so much. First, I want to say congratulations for all of you. You did a great job. I think this is why we need to have these kinds of platforms. You are doing an amazing job and people need to listen to what you are working. And I believe in this room, not only in this room, but virtually, there are women, young girls, medical students who will be really inspired by watching your presentation and amazing jobs that you are doing. So saying this, I only have two questions. I think one for Dr. Salam, Ethiopia Medical Women Association, and for this. So Dr. Salam, I think there are so many researchers in this room. Yesterday, we heard a lot of amazing presentations, scientific presentations, but usually this will stop at the stage of publication, but you went beyond that to prepare a policy brief. So I really want you to highlight the process and how really is the impact of, going beyond publication to the stage of policy brief. What is the impact of, having a policy brief? And at this, I think you did, it's really amazing how broad services that you are providing, and we're really proud to have such an institution in our country. So connecting information with the service delivery. So saying this, how do you ensure affordability of these services? I think there is a huge demand and affordability can come as an issue. So how do you ensure, during that connecting service seeker to the service provider, how do you ensure that those services are really affordable by, the majority of the population? Thank you so much.
Thank you so much. Please.
Thank you all. It's a very interesting presentation. My question is for I met the Yani Health team last time and I was also discussing this thing with them and for Abatin. My question is, you are all working in a very sensitive topic, especially family planning issue and menstrual tracking and so on. They might have, what is your data protection policy? They might have a strong repercussions if some of the data is leaked. So how are you guys working on that?
Thank you. We can have one more question and
Okay, thank you. It was a wonderful presentation, and I'm really proud to hear what all of you guys are doing. I have a really simple question for the tech-based services that you guys are giving. I heard it being mentioned on the TANQUA presentation as well. There's a lot of women that need these services but don't have any digital means to get them. And what I mean by that is not just the technology itself, but the knowledge. So do you plan or do you have any ideas how to incorporate digital literacy and maybe go a little beyond and give them the tools or find support for them in that regard so they're better usage on your platforms? Thank you.
thank you so much, everyone. It was really, really interesting questions. So we have questions regarding digital literacy and the digital gap. We have questions regarding data protection, such sensitive topics, and also have a really interesting question regarding the importance of going beyond the policy, the research publications, right? We do so many research, but look, they end up just being research on the shelf. So what is the impact of it? So first, I'm going to give the stage to Idist because, like, I'm sure you have so many questions in Salam. Then you have to. Thank you.
Sure, yeah. Thank you all for your questions. These are really great questions. And it's interesting because these are questions that even our teams are always discussing. As you guys mentioned, it's a very sensitive topic that can raise so much controversies and so on. But we always try to take in all the challenges, the questions, and think about how do we effectively work on these. So great question. So the first question regarding the women in rural settings. So how do we reach them? That's a question we always get. You know, when it comes to women in general, they're the most digitally excluded group of segment of society. So that's even its own challenge, right? Just talking about technology. One of the things that Yene Health is doing is we're trying to create a structure with Ministry of Health and the urban health extension workers and extension workers to see how we can deliver our platform through those care models, right? So we may not be able to reach that woman directly with her phone. She may not have a smartphone or so on, but there are current existing structures that are already reaching those women. We're trying to build on what's already existing and add value with our platform. So through that model, for example, the extension workers can use our learning content, our videos, our learning materials to go into those rural areas, do their campaigns, use that to educate women and so on. So that's currently how we're looking at it. But that's a thing that I think we're trying to figure out new ways always. Regarding women with disabilities, that's very interesting and something that we've been recently thinking about how to approach. But one of the things currently on our platform that allows us to somewhat make a lot of our services available is the fact that all of our content and services are available both on the digital platform, but also through a call center. So we're working with MSI right now to utilize their call center. So if a woman, let's say, is unable to, go on the platform and use it for any reason, she can always call or have somebody call and access us and say, hey, does your home clean, where can I go? Or I was looking for this service. Do we have it in Ethiopia? How can I reach this? So that's one way. The other way is that even with our learning content, as you saw earlier, we have not only like blogs and articles, but we also have videos. So for those women that prefer to listen to something or that have a hard time reading, they can just listen to the same topics that we're talking about. So there's those different opportunities for women that may encounter those challenges. Somebody asked about challenges we face in general. I think one thing for us, for Yene Health particularly, is that every time we go somewhere, especially if it's not people like this in the room, they think that the problem we're working on is a luxury, is something that's like luxurious, right? They think, oh, it's women's health. Oh, they can just go do whatever. Like, it's not that big of a deal. It's not a key issue, right? Especially when it comes to, fundraising money for a startup like this. Investors are really interested in their bottom line. So when you talk about these health impacts measures, they're just like, oh, that's not really whatever. So I think one big challenge is convincing people, including people that may not be women, men, to understand how much of an essential and critical topic this is if they're not from this space. But also us, like I said, we're not an NGO. So also oftentimes people expect us to be an NGO. And we don't really believe that as an NGO, you can sustain something like this. So we try to always, make a case saying that we're not NGO because of this reason, we want to be sustainable, but there's also a way for it to work. So the fact that we're a social enterprise also raises some challenges. The role of men regarding the knowledge gap was a question that you brought up. That's interesting. Again, like I mentioned earlier, men have been approaching us as well on some of these issues. One way that we're trying to address that is through our educational aid kits, for example. So one of the root causes that we identified during our research was that since we young women weren't being taught about these things, young women, young boys as well in schools, they were having misconceptions and there were so many myths that they believed in and so on. So by working with high schools and interested other parties that would allow us to give our content, we're trying to teach both men and women, young boys and young girls, youth to understand what happens during the stage, how what's consent, what's this, what's that. So that's one way that we're trying to tackle that by working with the educational system. How do we address judgment and stigma was the other question. So I think the beautiful thing about an app, although uptake might be difficult by majority of people, but is you don't need somebody, like you're not facing anybody else, right? So one of the issues that we had, the problems that women face, the barriers that we found was that even when a woman goes to a pharmacist and asks for a certain product, she's faced with judgment, right? But now you can do that through a phone. The phone's not going to judge you. So that's one direct way from us being a digital platform that cuts out the stigma and judgment, which then again enables women to be more confident, empowered to say, hey, I also have this question, I also have this, and they can just ask in the app and get the response. So that idea of being anonymous is a key way that I think, because we're a digital platform, that allows us to do that. The last couple of questions regarding affordability, that's also a great question. I think now we're starting to broaden our products on our platform. So it's the discussion that we continue to have with our partners. But the key thing for this question is partnerships. We don't work alone in any of this work that we do. Because I mean, we're a tech company to begin with, but also we work with current players in the ecosystem to make sure that they understand and that they're mission aligned. Our mission is to support and expand access to products and care, right? So we want to make sure that partnerships that we're working with understand this and have the same mission. So we're able to negotiate prices, get discounted features. So when we add a feature or service on our platform, it's going to be either at market price or below as much as we can. So I think as we continue to foster and develop stronger partnerships, we'll be able to really address the affordability issue that currently may be a problem. But also working with government. I mean, that's the most important thing as well. 85% of this space in general is served by the government and NGOs. So us as a private sector actor, we need to engage in the ecosystem to make something meaningful. So I think that again plays into a big role on that. The data protection question, yeah, that's a very important question that you asked. So that's something that we are day-to-day reviewing and updating our privacy policy and so on. But we try to base it off of standards that already exist. As you know, Ethiopia's kind of digital policy, especially like digital health policy, data protection and so on, is still at its infancy. So we're trying to work with the policymakers as well to understand that, but also create a way that really enables the woman to know that her information is safe, that it's private as well. So we're creating even different features on the platform that will allow us not to know who the person is at all. So using kind of encryption code to know that even our team won't even know who the person is, and all the data will be kept and encrypted and stored privately and so on. So it's an ongoing thing that we're working on, but it's something we take very seriously as well. And the last question, sorry, I'm done, is the digital literacy piece. So again, going back to the call center, that's a big way that we're trying to push that. So through our videos, we do try to make small like tutorial videos so that women can know how to use the platform or know how to access us, but also through the call center. Right now we're creating a script so that the call center, when somebody calls MSI, they're really briefed about Yani Health. So the next time, instead of calling, they can go so that they can go directly to the app and don't have to call. So that literacy piece is kind of ongoing, but also we're trying to do standalone trainings as well for women. It can be in rural areas, local areas, schools, universities, just short little trainings around like literacy, digital literacy, health, and so on that we plan to incorporate that with. And that's all. Thank you.
Okay, thank you so much again for the questions. I will start by addressing why it was important for us to publish a policy brief in terms of its impact, because we thought it would be a good platform to reach to those non-specialized audiences, because it's not, we have not done the research just because we went to reach out to the academician, but we wanted to reach out to policymakers, different stakeholders that have direct or indirect impact to the health system that is confining the reproductive health care. So we wanted to reach out to those non-specialized audiences and want to make sure that they have a clear understanding about what we're trying to say and how the pandemic affected reproductive health care. And one of the good things about Policy Brief is it is a platform that clearly holds a message that's adapted to a specific context, a specific nation context. So people can relate it, policymakers can relate it, and as I said, other stakeholders could relate it because it's a very context specific. And we also use this as an advocacy document, even though we have the data and even though we know that there is a gap in evidence, we have to make sure we advocate using the data, because one of the tools that we use in advocacy is having evidence. So we are using this tool as an advocacy document as well. So that's why we prefer to publish a policy brief. The other question that I was asked is about challenge or specific barriers. So as a women researcher, it was really difficult. It's not easy to do a research and then publish it and then, present it to stakeholders. And it became difficult thinking that we were only women researchers. I will read to you one comment that I get from LinkedIn after we post about the event, the launching event of our project. So it goes like, how do you feel if you see men only research team? Classic double standard. I have to tell you that your report is already biased. This is from a traveling scholar and a PhD candidate. So imagine if a scholar who managed to reach at that level thinks that women only research team would have a bias on a research that we do following the whole scientific protocol. So imagine what the rest of the people would think. So this is an actual barrier. And what we would like to do is actually breaking these barriers, making sure that we have facts, we follow the scientific rules, we make sure that we get mentored by very good researchers. So in that way, we stand firm and we make sure that you guys listen to us, because we are here with evidence and scientific data. Thank you.
Thank you. Both Idris and Salama has raised really interesting thing. One is partnership, right? So partnership is key, like not for the sake of saying it, but working with health extension workers, working with the ministry, working with also pharmacists, working with disability organization, working on disabilities, working on media organizations. It's really key because first and foremost, like this kind of problems, reproductive health justice, and they're not just standalone problems. They come with different layers of problems, comes with injustice, and also injustice are really intertwined with our culture, with our society. So we need to have a holistic approach in order to address it. So it's really interesting to see both of you seeing it in a very holistic way and try to tackle it in a very holistic way. So thank you so much for that. I also really appreciate what Dr. Salah might say regarding it's really difficult being a woman also working in the sector, because so many research teams that we know are mostly men only, and nobody seems to care regarding that. But when it's women doctors working on women issues, it's a problem. So really following the scientific protocol, following and also being firm and also mentoring one another is really important and key, and also creating a very, very conducive environment for doctors, for innovators to come together and also think and also do and create something. So thank you so much. I'll move to you too. Thank you so much. So you both will address the questions that are forwarded to you. Also other questions that you want to reflect on. Thank you. I'll start with
you. So I think Kadis has mentioned a lot of things when it comes to digital health, and I want to say thank you for that. But when it comes to things that I would add is, so one of the challenges, one person asked about challenges, and most of the challenges that we faced was, one, the team is very young, and as a young team that hasn't had that much experience, what we brought to the table was, one, the medical side of things, and two was when Tiki app came out 3 years ago, it was supposed to be an application that mainly centered on women, and we never really looked at the sustainability options because it was just a group project in a medical school, and it was how we learned. So when the first app came out, when we were talking about women, the traction was there. We were able to get a lot of attention, and we were able to get a lot of mentorship and a lot of things and funding when it comes to that. But because of the lack of experience, that was one of the challenges that we had. The second one is time. time when it comes to medical school. And I, just as I've mentioned, I completed medical school a month ago. And because of the lack of time, there were a lot of things that we wouldn't like. And as a woman, you have to juggle a lot more things, including stuff at home. And it was a very challenging time. But the best thing about femtech is that there are so many people that are willing to support you. There are a lot of people that even like the other woman in the room is so happy to see another woman in the room. So it's a very nurturing environment. Even men, whenever one person asked a question about men, and I remember when we launched the Tegi, it was about so how do we help women? Even in a question that like doesn't it occur in women? Why is it only a woman's app? And the one thing is that one, we really like the excitement. Two is a lot of men now really want to encourage and nurture the femtech industry. And we've been getting a lot more opportunities when it comes to not just femtech, but any other tech platforms that you want to have. The fact that there are a lot more doors being opened is an opportunity. When it comes to the platforms, as we very even the Google Play and the Apple Store, I'm very sure like this also goes through this. There's a lot of security questions that you're asked. It takes about months to publish a single app because of data tracking. And not only do we take it seriously, like also Google Play and Apple Play take it very seriously. So we have to have policies that are in place inwards and then outwards also. But one thing that we want to add is the reason why we have these platforms, especially the Telegram bot, is through the Telegram bot, it's very anonymous. I don't know if you guys have ever heard of the term of the platform Ventir. So Ventir is a platform where everyone goes and the users go and they can vent out their problems. No one knows who they are if it's anonymous. So that's what we try to provide when it comes to Ask Saba. The other thing is when we set out, so like I said, it was I was a medical student when I started. And one of the things that was very pressing to me was being an unemployed GP, that we have so many right now. So one of the things that we really wanted to fix was to make sure that we had employment and doctors, not just employment, but even volunteering opportunities. We were very fortunate enough to be able to look at the volunteering opportunities we had when we were medical students. And hence, when we graduated, we didn't really have the same opportunities now as our other colleagues, but we wanted to create the same volunteering opportunities now for our peers and also for our juniors. And it was something that it's very important to us that we are able to create these opportunities. So we want to provide the platform not only for our users, but we also want to make sure that we're collaborating with people. Also, just as Gadis mentioned, it's going to be something that we want to have collaborative efforts on everyone. So it can be from a single doctor or nurse or a pharmacist that goes all the way to patients in the rural areas, and it goes up to the Ministry of Health or even the WHO. It's something that we plan on building up, and it's about building systems, not just building a certain thing. So the best thing about digital platforms and tech is it brings everybody together, and it's very simple to use. The one question that everybody asks when it comes to digital platforms in Ethiopia is, how do you plan on making it available? So one of the things that for us, we're not fully a tech company yet. We're more based on health, that health aspects of things. So whenever we're looking at that, it's about getting the message across. So we plan on doing more community outreach programs in schools and rural areas. So for us, it's about getting the message across. So we really believe that the message and the way we can destigmatize these things is to have an open conversation. And that's why we try to do the digital platform. It's about having a space where everyone feels comfortable enough to have a conversation. So in order for us to start a conversation, one person needs to get up and start the conversation. We need to talk about it. We need to discuss about it. We need to ask questions. So that's what we really plan on doing when it comes to like our platform. So when it comes to digital platform, we believe that it can be accessible for everyone that has the access to smartphones or even a telephone to have the call center. But when it comes to the rural areas, we plan on collaborating with major stakeholders that can help us get there and actually having the conversation in person, as opposed to just making sure that the digital literacy gets there too. Thank you.
Thank you for the questions. So I'll start with the challenge as well, because that's an interesting place to start, I guess. So the first challenge that we have as a podcast is like like podcasts being a luxury and SRHR also being a luxury as well. People comment on our episodes like there is war going on, there are lots of instabilities in the country, and here you are talking about menstrual caps. And well, yeah, that actually happened. But well, that's that when it's considered as a luxury, then it's kind of like we also feel like are we making a mistake? Are we like really addressing the right question? But we get back on our feet. So that's one of the challenges that we have. People actually think podcasts are luxury, and SRHR is also a luxury. The second one is the digital world by itself is it has there's lots of things happening out there, and there are lots of things happening in the digital world as well. There are lots of the digital world, and also as women, and as women in rural area, we it's kind of puts a question on all the works that we're doing. But part of the work that we do is giving responsibility for the people that we give the information to pass it around. Every time we talk about something and we say, please tell this information to the people around you. And I think that's one thing we have as a podcast, since it's an information and it's not a service that we don't expect people to actually come to us. Since it's an information, we give the responsibility to our listeners to pass the information around. And currently, we're also working to have on ground podcast clubs. You know how people discuss books, after reading them, and we're also planning to have podcast clubs where we discuss podcasts in universities, specifically in Addis Ababa and Hausa universities. So we also hope that will help to cover that will help to in contributing for the digital gap. The other thing that we all should work on, everybody in the room should work on, is to press the importance of the digital services. Like we're always talking about how we don't have access to multiple things in our world, but we don't talk about how people don't have access to the internet because we tend to forget that information is power, and we're denying our people the right to have information and the right to have power. And as a Tankwa, as an SRHR advocate, and as a citizen, I think we should all take responsibilities to advocate for digital access to everywhere around the country, and that's a responsibility we should take as well. The other problem is menstrual. The other question that was raised is menstrual. So we, as I told you, had the opportunity to work with adolescents for quite a while before starting the podcasts. And we saw how men also want to be included in the SRHR conversation, how men also have lots of problems in the SRHR things that are happening. And so we had the opportunity to include men in our conversations as well. We also have a main podcast host. We are very proud of the work he's doing. So there's also that. So there was also a question about challenge as women. I think that one of the protective aspects just mentioned, one of the things that the digital world allows us is we're anonymous. No one knows us. So we're that gives us the freedom, and we're also covered, like we pass the information and we take questions. So far there hasn't been any backlash on how we're women and all that. So thankful for that as well. I think those are the questions. Thank you.
Thank you so much. If you ever see Venture, she talked about it. It's a very good example of how if we don't control information, if we don't control information in the sense, if we don't know the source of the information, whether it's valid or not, that's what it will come down to. Like couple of people talking about their problems, and anonymous people we don't know their background giving advices, ridiculous advices, like I'm not kidding, I'm sick, or I had intercourse 3 or 4 weeks ago, can I take the post pill? And they say, yeah, you can take it. And also I'm going to have an abortion, where should I go? Directing them to not clean, not secured abortion facilities. It's really, really pressing issue if you see the information out there where young people, adolescents, where they're getting their information, also that information is not fact-checked, that information is not processed well. So it's really is a very, and thank you so much for doing that, because Telegram is now one of the leading app in Ethiopia, and also tapping into that market is really important. But as we all know, mostly like, fake newses or some like tabloid newses are really easy to just take and process. So thank you so much. I think that's why she raised the question of data protection as well, because also fact checking our data is really important. Now, I really want to ask you guys, like to get this talked about, whenever we go to a room, not this kind of room, but they might think, it's a luxury. I also want to talk about, what about this kind of rooms? Do you think there is a robust understanding of innovation in the tech sector, in the SRHR sector, not only in the SRHR, in the health sector? Do you think a robust understanding of that? And also what enables hinders innovation in the SRHR sectors? I really want to talk about that. This can start, and whoever wants to reflect on that can also reflect.
Yeah, that's a really interesting question. I just thought about it right now when you asked it, actually. I think from our experience, there's definitely a gap when it comes to innovation and tech innovation and the SRH community in general. I mean, just the health community, especially in Ethiopia in general. But I do see progress, and I think there's better understanding in this ecosystem. But I think one key role that we're trying to play is, how do we catalyze that? How do we become the one that comes in and bridges the gap between people like this in the room and people just with a tech background and people with the innovative background, and bridge that gap? So I think throughout our work, it's something that we take as a accountability and responsibility to make sure that there is a better understanding, comprehensive understanding, and also like belief. And I feel like sometimes, when we first started, we went to all of the SRH players in Ethiopia. We did a stakeholder mapping. Who can we work with? Who's doing anything in digital? Who's not? How can we partner with them? How can we add synergy to what's happening? Because we didn't want to reinvent the wheel. And surprisingly, a lot of the time, especially with the big actors that we got, was lots of, resistance when it comes to tech innovation. Oh, that's something new. It's not going to work. Women won't use that. That's a Western kind of thing. So I think there's still kind of fear that it won't work. But I think when people see, they believe. So we're trying to create something that has traction, that is actually, that women are using, that can be a testimony for people like this in this room. Will kind of, get rid of that resistant mindset and kind of say, oh, this is what we need. And we can also use that and leverage that to reach the most number of women at the lowest possible cost. I think efficiency is a big thing that we're also offering, is we can reach far more people using a digital platform than we can reach, by just having a traditional brick and mortar facility. So I think when that kind of continues to grow, we'll see a shift. So I think number one is regulation, so policy, right? So I think one thing we also encountered many times is there's so many barriers to what you can do, what you can't do, sensitive thing, but also because it is a sensitive thing and our society has a certain perception of it, sometimes it's misconstrued as, oh, you're going to be promoting these kind of things to happen. So there's that with it. So I think policy and regulation and just like the thoughts that we have in society hinders these kind of things to happen. But again, I think once they see the impact, it'll change. And enablers are people like us, people that are actually committed and bringing in innovation and saying, you know what, we're going to try it. We're going to see what happens. If it works, it works. If it doesn't, then we change track. So the upcoming startups or organizations that are working in the innovative digital space, I think those will be the ones that will break barriers and get, become an impactful enabler. Yeah.
You want to?
So again, I think this has mentioned a lot of points, but I remember the first time, I guess I always reflect back on my experience, and I remember when Tigi came out, it was so surprising to people
that there was an application that people can use to do self-test examination at home. So it was a very surprising thing for people to know that they can use their phones for information, and it's verified information. So now it's more like, so even now, but now we even have competition. So even now your app or your digital platform has to be at a certain point for it to be competitive. It has to provide something, it has to have value. Whereas previously, just because you had an app, you would be invited to places, you would have like a greater thing and people would praise you. But it's not the same now. We have competitors, we have people asking us the right questions, we have how many, we get asked questions, and that's saying a lot. Even in the past 3-4 years that I've worked in this, I've seen a lot of change. There's more platforms that are being made. There are more stages being made for us when it comes to digital health platforms, digital health week by the Minister of Health. There's so much of a difference and we have made so much progress as a country. And yes, there's still some minor things that the Minister of Health, even in like the people in society and our cultures, there's still a lot of influence when it comes to things. For example, I remember talking about Saba within the Ministry of Health, and the main thing that we mentioned was censorship. So there were a lot of questions being asked about censorship because what we talk about is something so sensitive, and just like you said, we were being told that you're promoting this and this to teenagers. When we talk about family planning and sexually transmitted infections, even though we learned these things when we were in school and they were on books. So it was something that I could not understand when we had that conversation in that office, because it's like you're telling people to use family planning methods, but you also teach them in schools. We just wanted it to be something that was organized and it could help people. We could see it in a positive way. There are a lot more things when it comes to culture. When that's something that hinders. But I believe that even with the digital health footprint that's now the Minister of Health is implementing, there are more changes than there used to be. Even in stages like this and being given these opportunities to speak, it means a lot, so that we can also learn what is missing when it comes to policy making. Here are the people that we can meet as our stakeholders, and we can also, not only can we be the bridge between the tech people, we can also be the bridge for users, because we now know how to bring users into the platforms. So you can use us to reach your audience as well as we can reach you to reach policies and more people. So I think these type of stages, they bring people together and we should have more of them. Thank you.
Most of it have been said, but one thing I wanted to stress upon is the importance of having conversations. So how do we enable digital health and anything digital really is through having conversations. One of the things that we learned while podcasting is basically talking. You just talk. So this can be a podcast. So basically what we learned through podcasting is that we don't have words for things that are very intimate for us, like things that we need. We would want to talk, an example would be, we wanted to talk about myomas once, and then, okay, so myomas, well, like there isn't a very explanatory term for myomas, and you would want to talk about autism. What do you call it in Amharic? Or any local language, really. So there was a very interesting thing that was raised in George Orwell's 1984. I'm sure many of you have read it. So it talked about newspeak. So a society cannot understand a concept which it doesn't have a word for. So I cannot be coming here and telling you about things that you do not understand in your culture, or you don't have a word for it in your culture. I'll be making definitions. Myomas are not cancer አይደለም, የዋህ ነው, it will just be weird and you lose interest. So the importance of having conversations is that we come up with terms once, and we also understand each other. I can tell you the side of being a podcaster,
and you can tell me the things about being a healthcare provider or a client. So I think that's how we can enable digital health or anything in the world. Really, you want to work more on breakfast, talk about breakfast more. I think this is a very important, and this at stage like this also contributes a lot to digital health and its growth. So yeah, that's what I want to say.
Thank you so much. So we're about to conclude, and I only have one question, but I also want to reflect. Most of the time, when we have any app, be it Facebook or Twitter or anything, we're not going to say, what about for this one? Or what about for this one? What about for and it's really good when we talk about like digital health app. We say, what about for people in the rural area? What about disabled people? It's really good because we really understand inequalities. We really understand, vulnerable people are the one really affected by this kind of thing. So it's really interesting to see people working in this area and this sector have really robust also understanding of inequalities. And the only way to bridge the gap is, as Loza said, by having a conversation, by having literally a roadmap to say, okay, we need to reach A, B, C, and how can we do it? Partnership. How can we do it? Having conversation. How can we do it? Honest and genuine discussion. So it's really interesting to see. So I want to ask you a question. Because it will also tell us the way forward. Assuming you have 10 million per funding, and as boards of funding to improve SRHR in Ethiopia, what would you allocate it to and why? Because it will tell us the way forward. Is it generating or developing innovations? So the more innovation type solutions. Is it scaling up existing innovation practices, or is it delivering essential services to delivery and programming? What's it going to be? Because and why? Don't say I'm going to invest it in my company. Don't. I just want to see it in a way of, you guys are innovators, all of you, and I also want to see, there is no one solution to also. Please reflect. Start from Loza.
An interesting question.
Okay, so
assuming that we have 10 million birr of worth of funding to improve SRHR in Ethiopia, what will you allocate it to and why? Is it generating or developing innovations? So the more innovation type of solutions. Is it scaling up existing innovation practices, or is it delivering essential services? That's programming in the whole. So thank you.
an interesting question. So I think I would use it to deliver essential services. But in essential services, I would mean access to digital services, because digital services are essential. So yeah, I know that's a trick question. so why? Because we can raise you can see it in the questions that you're raising as well. We're leaving women behind. We're leaving lots of adolescents behind. And if all of us are not, there was this quote, I forgot the woman, I'm sorry. But if all of us are not equal, none of us are equal. So we're leaving women behind. And so I think I would definitely use it to deliver essential services, but digital services, essential service. So for that, yeah.
So as a person who's both in tech and in medicine, one thing I can tell you is in medical care, things have improved significantly when it comes to essential care in the healthcare center. Now, mothers are able to have free healthcare when they want to give birth, and even NICU care when it comes to a lot more essential care, it's free. So this says a lot about what's motherhood and even reproductive health care, sexual and reproductive health care when it comes to local healthcare services. It's available. It's almost free. When you go to the local healthcare centers, those essential healthcare things are mainly available. But so what I want to work on is scaling up the existing services. If we scale up the existing services, any type of new innovation that can come in actually has a pathway to succeed. So what we have as a problem and as an obstacle is
One, when we say we want to scale up, we also want to scale up the way of thinking when it comes to these major stakeholders. We want to let them in when we want them to let us in, to be exact, actually. But we want them to be open to the idea of innovation. And I think that the more we do that, the more we actually talk about how important innovation is, and how much, before we talk about how important innovation is, we need to open the minds of the people who are really in charge. And the way we do that is by scaling up the existing systems. So once we do that, any type of innovation can come and be successful. What we really need and what we're really lacking is that open mind and the open resources that we really need. So
Thank you so much. Understand.
Thank you. So I think differently about this. I would completely invest it all in innovative solutions. And here's why. So I think the other options you gave was essential services and then scaling service delivery. So I think, let's think about it this way. Let's think about the transportation industry, right? So we have buses, we have minibuses, we have transportation that already exists. If we try to scale what's existing, we're just adding more traffic. We're causing more longer lines. People, efficiency is not increasing. It still becomes a problem. And the essential services are still there, right? People can go from point A to point B, essentially with the current thing that's there. And I think Yene Health was actually, Yene Health exists because the current environment is not meeting up to the demand, right? It's not solving the problem. So for this, for SRHR and health and tech to be robust and dynamic, I think if we invest in innovative solutions, they're able to optimize, make the current existing systems more efficient, scale faster, and grow faster. So I think because of that, the more we invest in innovative solutions, just like Ride, Ride was an innovative tech company, right? They came in the picture. Look how much impact they've made in 4 years, where in the last 20, 30 years, we haven't made that much remarkable transformation in the transportation industry, right? So because of that kind of mindset, I think investing in innovative solutions will allow, will really create healthy disruption that will foster great ways to, leapfrog into the future, but also access and reach and access more people in an efficient manner.
Thank you. So my answer with me my answer would be, as a full-time researcher, I would definitely use the fund for research, because we currently have an ongoing conflict and, of course, other humanitarian and complex settings in Ethiopia. And I was discussing this with my team. We need to have Through Her Eyes phase 2, because this challenge would have would cause a different perspective for women. So I would use the fund to make sure we have evidences that support our assumptions, to identify the gaps. How does ongoing conflict, humanitarian settings, the droughts affects women health, and then make sure that we reestablish those that are got destroyed, at least help in a way that incorporate different innovations that and making sure that we have basic service delivery. So I'm not going to choose A or B or C, but I'm going to blend all those, make sure that I'll make the best out of it.
Also for our research and also for digital gaps. And so it's really interesting. It really shows us how we all have different solution to an existing problem, which is not a problem, which is really, really okay. And that is, I think the problem would be, oh, this should be the solution for this specific problem, but no, it's not. It's good to solve certain type of problems only, which is also okay. We don't have to solve, right? Like Ride is a really good example. Ride did not solve those people who couldn't afford to, to not call like Ride, like those people who couldn't afford it and also don't have the access to call it. And it's really good to have this kind of understanding, also understanding inequalities work in a very intertwined ways, and we really need to be mindful of that, because we don't have to widen the gap regarding SRHR. We really need to bridge the gap between digital solution also the digital literacy as well. Thank you so much, all of you, for your time, for your insightful comments, for your insightful discussions. I've concluded my questions, but I'd give chance to two people if you have any questions. Or two people. Okay. Only her? Is she?
Hello, everyone. My name is Desna Mortana. I'm a medical doctor, and I'm very happy to see two of my juniors here. Dr. Loza, who I went to INGS with, and she was my junior, and Dr. Vital Samson, I learned in Black Lion Specialized Hospital together with. And my question when it comes to this digital health and digital aspect of solving so many of our health problems, and what I want to ask is, when you mentioned this, that the digital health policy in Ethiopia is at the infancy stage, and it was a problem I entertained also when I was the project manager for Latina Ethiopia, and the kind of information we're putting out there, it not only have to be factual, but it also has to be sensitive to the mental adequacy and the mental issue. So when you discuss those things and when we don't have a policy to guide us, how do you entertain these problems and how do you solve them? How do you put that kind of information out there? Because currently the internet is becoming a very dangerous place, and a lot of people are getting not only false information, but information that's not appropriate for their state of mind and their state of development at that level. So when we entertain these solutions and these digital health-based information systems, how do we go about mitigating these problems as well? And the second one would be when we come to the digital health aspect of treating patients through call centers and a lot of other mitigation strategies. Also, so there are this old adage of patients coming into, all of us have experienced that not only do the solutions matter, but also the doctor's touch, like that reassuring stage. So when we come to this solutions, call center based and digital based solutions or treatment centers, how do we mitigate in a way that we reassure the patient's state of mind that like the sickness and also all of it will be solved also, not just by medication, but by the physician's touch as well. Thank you so much. And it's very nice to see all of you here.
Thank you so much, Dr. Bethlehem, for your questions. Maybe this can reflect, and also, do you want to reflect? Yeah.
Yep. Thank you for those two great questions. So your first question is pretty much how to deal with content regarding the policy structure and also making sure that the right content is reaching the right audience with their personal mental status or understanding. So, I mean, so within our team, there's different levels of, we vet all of our content, right? So we have proper templates that we use, and there's objectives that we design out of each content that we create. So we really try to create our content in a way that it's action oriented. So if we're talking about STIs or STDs, it's designed in a way to empower women or whoever's reading it to seek and go get tested if they need it, or go get, take the preventative measures and so on. So we already have a standard, that we use. So it goes through that. We also have different levels of our team members that go through each one. All of our content is developed by physicians or other health professionals. So it's also, evidence-based, reliable information that we strongly make sure before we post. Regarding, at the end of the day, I think with digital platforms, the biggest challenge, one of the challenges is, again, you can't really control who's accessing that, right? So somebody can, for example, one thing we're trying to do is we're trying to separate our content for adolescents and for like adults, right? So one thing we can do on the platform is we can put an age limit, right? So if you're within a certain age limit, you can see certain content. If you're above, then you can see that. At the same time, somebody can lie and say they're 25 and then they can see everything, right? So there's only so much control you can take on that. But from our end, as much as we can, as is possible, we're trying to set those measures to make sure that dangerous information or inappropriate information is not getting into the hands of one of our users. Your second question about the physician's touch and practice, that's actually something we haven't really thought about or got into too much, just because we're a bit, we just started as well, and we haven't really discussed that with our partners. But I think having physicians on our team as well, like I said, we have 18 doctors that work with us, and having their engagement with us, but also they're able to take back to their clinical practice and kind of share that amongst their team members. So there's a little bit of kind of impact that comes through that. But there's no direct way that we have a direct role in how that goes. But we do try to educate women on how they should be treated by a doctor, what questions to ask a doctor when they want to be seen for something that could be sensitive. So at least it adds a buffer for that interaction.
Thank you. So, just what Dr. Bethlehem said, it's very important to know who your audience is, and the way we approached it was more on first knowing what our market audience is. So when we looked at our market audience, they were more they had access to internet, and they were more I guess tech savvy. But whenever you looked at those people, it was the main problem that we have identified is it's it also includes everybody in the room. Whenever we search for things, we want it to confirm our ideas of things, and we want us for it to say yes to the idea that we have in our head. So that's one of the major issues that we have. So let's say we provide an factual information, and a lot of the things that we've seen. So we've also tested our app. We've had prototypes. We've had our websites. We've talked to patients. But I think as every physician, you know that patients just want to say, yes, you can eat that food. Yes, you can, like, yes, you can take that. No, you don't have to take your medication. That's kind of the things that patients want to hear. So it's very tough to communicate in these situations. So we've addressed that, but we really rely on the approach of the way we talk to our patients and the way we talk to our users. So whenever we use these information, we try to make it as interactive as possible. We make them ask us questions. We have a very open idea whenever it comes to these things, is because we are very focused on having the conversations. We don't really want to just give the information and then they take it or leave it. We try to open doors for conversations, and that opens a lot of way. And the second question was the doctor touch. So the way we want to implement our projects is also throughout the collaborations of local healthcare centers. So we want to be able to guide our users to local healthcare centers. That's also a way that we want to make the way that our services are built. That's how we also want to make it affordable, is because we already have existing systems, and we want to also collaborate with the Ministry of Health. Also, we want to collaborate with healthcare centers and healthcare providers. And just like I've mentioned, we want to employ doctors. We want to create a platform for active physicians. So we want to have those doctors have a voice, and we want them to be part of this. So that's what we're using. The doctor touch is very important. So we make sure that it's available whenever it's a local healthcare center, might be guiding our patients, our users to have that access. And we also provide that platform that they can access doctors in their actual form instead of just texting. So that's the way.
Thank you so much again, all of you. So I think by the end of this, you all will subscribe to Tanko, right? Will download their app, their Tegi app, also know about Yenitech, and go to the website, and whenever the app is ready, download the app, and also read the policy brief of Through Her Eyes. It's really interesting. I've had the chance to see it. I've had the chance to participate. It's really interesting. So take my word. I know all their work, so take my word. So innovation goes beyond what we talk, right? Innovation goes beyond it's not. It really goes beyond that. So we also need to have a really tech savvy kind of eye to see, you know what, we need different solutions to our existing problems. We need to be really considerate of what the current time and age really requires. So really thank you, Sandpol, for taking the initiative, for whenever we talk about journals or scientific symposiums, to think about the traditional ways, but this is really interesting. So thank you so much also for inviting me to facilitate this really great panel. So I'll give back the stage to Doctor. Thank you again. Have a lovely day.